Digestive drugs by Douglas and Borland. Plumbum. It is very difficult to give a coherent story of the uses of plumbum because it seems to fit such different conditions. Plumbum is occasionally indicated in infancy. The child is wasted and shriveled, looking with a very large abdomen and obstinate constipation, and a history of violent attacks of abdominal colic, which make him double up. The infant has a very offensive odor, sweaty skin, cold hands and feet, a very coated tongue, and in addition to the abdominal colic, is liable to attacks of cramps or generalized spasms. He has no appetite at all and refuses any food or drink. There is another plumbum type at the other end of life, a patient who has had a cerebral hemorrhage, a flaccid paralysis of one other side, and is suffering from the most obstinate constipation, particularly if the constipation is associated with abdominal colic. In these cases, there is the slow mentality of post-apoplectic, a general mild depression, and faulty memory. Instead of general abdominal distension of the infant, there is much more likely to be somewhat retracted abdomen and complaints of feeling as if the abdomen were being pulled in. They get sudden attacks of violent colic in which the pains are rather better from pressure and eructation of wind. It is not only at the two extremes of life that one gets indications for plumbum. There may be indications for plumbum in sclerosis of late adolescence, where it is associated with obstinate constipation, a generalized milk anemia, a very shallow, somewhat greasy skin, and complete loss of appetite. There will be in addition the peculiar plumbum mental picture of sluggish mentality with poor memory, frightfully slow mental reaction, and in spite of the general mental sluggishness, history that the patient finds difficulty in sleeping. In these cases, the patient may suffer from somewhat chronic gastric catarrh. There is a feeling of nausea, a complaint that everything seems to turn sour, and the vomiting of quantities of sour material. In spite of everything turning sour, they sometimes complain of very troublesome sweetish taste in the mouth. They are liable to violent attacks of hiccough. Frequently, they have a very dry, red, glazed-looking tongue. These cases suffer from obstinate constipation, often accompanied by an acute spasms about the anus on any attempt at defecation, and a feeling as if the anus were being pulled right up into the rectum. Associated with constipation, they often complain of a very severe pain in cecal region. They are liable to suffer from acute headaches with the constipation and complain that the effort to get the bowels to act is so extreme that they are completely exhausted by it. With the constipation and sclerosis, these patients very frequently suffer from crops of boils. Plumbum sclerotic adolescents are always neurasthenics, and they are very liable to sham all sorts of illnesses which they have not got, particularly ailments associated with some kind of paralytic symptoms. They say they feel almost paralyzed, or they cannot use an arm or a leg, and they sham beautifully until they think there is no one watching them. These neurotic patients often give a history of attacks of difficulty in swallowing, as if there were a spasm of esophagus which made them choke. These patients are often troubled with cold, sweaty, very offensive feet. They complain that the skin of the feet, particularly between the toes, is almost as if it had been steeped in water and looks half macerated. Plumbum patients are intensely chilly, particularly sensitive to damp and upsets by any exertion. They have one very peculiar symptom. The more they walk in the open air, the colder their legs and the feet become. It is a symptom I have come across several times in these abdominal neurasthenics. There are two other conditions which give indications for plumbum. One is acute jaundice, in which there is a very dry, shriveled appearance with the typical jaundiced skin, very constant, very marked, acute nausea and persistent vomiting. There is acute constipation and pretty acute pain in the liver, which is very tender to pressure, and the pain extends right through to the back, sometimes right over to the left side. The vomit is a green bilious mucus vomit. These cases of jaundice have a heavily coated tongue, and there is liable to be generalized muscular cramps. For plumbum to be indicated, there must also be the plumbum mentality, the general sluggishness, depression, and complete loathing of food or drink of any kind. The other condition which may give indications for plumbum intestinal obstruction. As you would expect in these cases, the patients get most violent abdominal colic, a feeling as if everything were churning up and an acute spasm were trying to force it past the obstructions. But the characteristic plumbum sensation is a feeling that as if everything were being drawn backwards up against the posterior abdominal wall, or a feeling as if there were acute retraction of the umbilicus, as if it were being tugged in. There is complete obstruction, no action of the bowel at all, extreme nausea. The vomit first consisting of food, ordinary gastric contents, then becomes sour, bilious, and finally fecal. All this is accompanied by very persistent hiccough, extreme sensitiveness of the abdomen to pressure, the slightest contact with the abdominal wall being painful, general cold, offensive sweat, and typical loathing of anything taken by mouth. Plumbum may be indicated in intestinal obstruction at any age. I have seen it indicated in children with strangulated hernia, in intussusception in infants, and in intestinal obstruction from intestinal carcinoma. I remember one patient who had a carcinoma at a splenic flexure. She had typical indications for plumbum, which stopped her spasms for months on end. She had no morphia at all, though before having plumbum, she had been having pretty heavy doses of morphia without any benefit. It was nearly making her sick. The strange thing was that at the postmortem, she was found to have an almost complete obstruction, even though after plumbum she had started to pass some fecal material. How it got through was a mystery. But the obstruction was up in the splenic flexure, where the contents are still pretty liquid. With these inoperable conditions, one can give enormous relief with homeopathy by prescribing accurately on their symptoms. A very small dose of morphia will keep the patient quite comfortable if they are having homeopathic treatment, whereas without it, they would be requiring half grains of morphia 4 hourly. I remember a child in the children's ward whom everyone believed had an intussusception. While he was waiting for the operation and to get him into a fit state, as he was very shocked, he was given 3 doses of plumbum and all these symptoms disappeared. He had had all the symptoms of intussusception, and yet after plumbum, they simply disappeared. It may be that the plumbum relieving the spasm allowed the intussusception to correct itself. The boy was about 2 years old and had been ill for 3 days. He was in a very collapsed condition and was really only left to recover sufficiently to fit for the operation, instead of which he recovered altogether. The description of plumbum under the heading Digestive Drugs ends here. Thank you for visiting my channel. Goodbye.